conference call with us. And I hope you can share all your knowledge and all the studies that you've done just recently. Okay, go ahead, doctor.
Yes, I want to talk about all the studies that I've done that are now in the PDR, because in the PDR we have all 5 different products in there and the studies that were done for each of them. So this year in 2018, when the PDR comes out, all 5 studies will be in it, including digestive and the Lamiderm Apex. Now, I want to review first the basic studies that I did before, and then I'll move closer to the new one, and I'll explain that one as well. First of all, the first study that I did was, which is with the omega and laminine, was initially to check and see what the cholesterol profile, how it would be affected. And the LDL, which is the bad cholesterol, went down, and the HDL, the good cholesterol, went up, and the total cholesterol totally went down. And also the blood pressure went down. And this is really important for us, because the cholesterol, when it stays up, eventually causes there to be more cholesterol that attaches to the walls of the vessels and clogs the vessels, and we don't want the vessels clogged. So the omega in the first study, which is a placebo-controlled study, and we showed that the omega actually lowered the cholesterol because of the omega-3, 6, and 9, which is important to bring the HDL, the good cholesterol, up, and it lowers the total cholesterol. And the coenzyme Q10 helps with lowering the blood pressure. And the vitamin K2 helps with lowering the calcium for the calcium, because the calcium builds inside the vessels and causes there to be a problem. So we want to get the calcium out. And what vitamin K2 does, it stops the deposition of calcium in the vessels, and it puts the calcium in the bone and the teeth. So the omega did a great job in lowering these things. But the omega with laminine did it even better, much better, and lowered the overall cholesterol and the high blood pressure. Now, the next study was done was the laminine study, which showed the effect on sugar. And so many people have diabetes, including Irene's father. And he lowered his sugar tremendously by taking laminine. So laminine, first what we did is we checked something called hemoglobin A1C. The hemoglobin A1C, for those of you who know much about diabetes, will know that this is what we utilize now as the main number for diabetes. And the clinical study that we did showed that we compared a group A and B, a group that was on placebo compared to a group that just took laminine to see how it lowered it. And the third group was a group that already had medicines for diabetes. So we compared all 3 of these, and it did a wonderful job. And the pre-diabetic group was the group that was initially involved. And we took their numbers, and as they took it over the 12 weeks or 90 days, we lowered the diabetic number down to normal. So we can actually take a person who's pre-diabetic and make them go back to normal, which was awesome. It was a very good study which showed that the normal level of hemoglobin A1C can be found and can go back to a low number and be normal once again. So this is something that's great for diabetics, because even if you are on medicine, it will also help you. We had one patient who was on medicine and insulin, and by the end of the study, her doctor, not me, her doctor took her off of the insulin because the laminine lowered the sugar so much. So that was wonderful and showed that we can decrease the number of medicines or decrease the insulin, or decrease different medications that you're utilizing to lower sugar. So we did a wonderful job there, and it did great for our study, and was just amazing. And we're so happy that we can utilize something natural that can lower sugar, so that people do not have to go on medications. That we can stop them before they will go on any type of medication. The next study was a study that was done on immune. And for the immune, we looked at what we could do, especially with the white cells. The white cells are very, very important for fighting infection. And the study that we did with immune allowed us to register how much B cells we have, how much T cells we have, and how much natural killer cells. And all three of these, because of the mushrooms inside the immune, would increase tremendously. Increase to show that you can fight infection with the white cells. The vitamin C is also important in there, but really the most important is the three mushrooms which cause the increase in beta cells, T cells, and natural killer cells. And they all increase tremendously over the 12 weeks. And again, as we find with all of our products, the immune helped with this, but the immune plus the laminine was even much, much better. So the third group was the immune plus laminine. And that was the group that increased the white cells the most. Now, the next one I did was the one on digestive. And digestive is a great product, which affects prebiotic, probiotic, and the enzymes. Now, this is a perfect combination for the digestive tract because it affects all three parts of the digestive tract, not only the esophagus and stomach, but also the pancreas and the small intestine, and then, of course, the large intestine. But this digestive study showed an increase in short-chain fatty acids, specifically, most important, being butyrate. And butyrate was increased and helped tremendously to show that the differences in DNA and problems that could happen with them could be possibly eliminated. So we showed for the first time that this can help you tremendously with trying to decrease the potential for tumors. So by increasing butyrate, we had a great increase in the short-chain fatty acids, which then turns into allowing us to maybe being able to help the GI tract tremendously with tumors. And then the last study, which is the most important one, is a study that we did on Lamiderm. What we did initially is we gave people Lamiderm and Laminin. So it was a skin cell regeneration from the inside out and outside in. So we take the Laminin to help us from the inside out, and we put the Lamiderm on the outside to help us from the outside in. Now it has to go through both layers of the skin. So it needs to get through the epidermis, then the dermis, to get to the dermis, which would then increase the amount of, because it increased tremendously the LOX, it increased the collagen and the elastin. By increasing the collagen and elastin, and once again from the inside out and outside in, we will start to look younger. As I've always said, we all want to look like our daughters, and how smooth their skin is, and how nice everything is in the combination of the regeneration. So we did this for 12 weeks once again, and actually we did it for 6 months. For a total of the 6 months, Laminin with Lamiderm Apex, both from the inside out and outside in, have helped increase tremendously the collagen and elastin. And not only did we increase it, it stayed up tremendously. It stayed up very high. So there were people who started at 30% collagen and ended up with 74% collagen. A lot of them started with 20 and 30% elastin and ended up with 70% elastin. These are measured accurately over the period of time. And we saw it go up, 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 and eventually stayed up. So the Lamiderm Apex gives us something very special because it gives the LOX, which is the important ingredient that we have in Lamiderm Apex, just like the FGF is the important ingredient for Laminin. And both of them put together will increase the tremendous amount that we have of both the increase in collagen and increase in elastin. So these are the studies that we did. These are the studies that are in the PDR. And as of next year, 2018, it will be reported in the PDR, not only omega, not only Laminin and immune, but also digestive and Lamiderm Apex. And these studies were also found to be very helpful and useful because in Europe, we tested with the Dermatex company. Dermatex is the company that will rectify any problems and will show us that the Lamiderm is safe and efficacious. So these are the two things that we want to know the most about, it being safe and being effective. So you can see that the collagen increases by 250%, the elastin 200%, and the fibronectin by 350%. And both of these come from the egg, the Laminin with the FGF, and the Lamiderm with the LOX or LOX. So these measurable results you can do, I've shown you in 3 minutes, and I go to these different presentations, and over 6 months shows that it keeps it high the way it should be. And all the different studies that we've done have become better and better better. So thank you very much for listening, and we'll open the floor for questions on any of the studies, on any of the problems, and anything that you may need to have me answer.
Thank you so much, Dr. Ran Guhar. It was an amazing presentation. And even by knowing all the facts, all the studies, every time I hear something new detail, and this is very impressive, what kind of products we have and what this product can do for us to stay healthy. Beautiful, beautiful. Thank you so much again. We'll open discussion right now in a second. I just want to tell everybody who joined the call, if you live in Europe, we have a unique promotion for LemoDerm-Apex. A gift duo. The promotion lasts till December 25th, and I believe this would be a best Christmas or a New Year or a Hanukkah gift for everybody, for men and women. So please keep in mind that you can call the person who invited you to this conference call and ask them to order this product for you to stay beautiful and have an amazing gift for everybody you love. Okay. Just a second, doctor. Let me check the list. By the way, for us to open your microphone, please click on the hand and we'll open microphone for discussion. I don't see anybody's, maybe we have so many new people and you probably don't know how to use this room. Please click on microphone. If you see microphone, if you listen on the